Well, hey there, it's Rena. For those of you who don't know me, my name is Rena Hedeman. I'm a certified professional career and life coach, and I'm also founder of Your Big Fun Life, where I help women redefine their next decade. Today, I am super excited because I've invited a good friend of mine. Her name is Kim DEramo to come talk to you all. Who is she? She is board certified in emergency medicine. She is also a doctor of osteopathic medicine, and she has written a best-selling book called The Mind-Body Toolkit. She's also the founder and CEO of the American Institute for Mind-Body Medicine. And she's here to talk to us about quick, easy ways to relieve stress, anxiety, tension, even when we don't necessarily feel like we're all that stressed. Our bodies often tell us otherwise. Oh, and by the way, if you're also interested in learning more about how to use the mind to heal and thrive, I actually interviewed Dr. Kim and her husband, who's also a physician, several years ago. I'll put the link to that video at the end of this interview. I'll also have it in the comments below. So without further ado, let me go get Kim on.
We're getting started.
Okay,
it's great to see you.
I am so excited to have you here, Kim. Oh my gosh. Kim and I met years ago and we instantly bonded, and I just love what she has to say. I love what she's all about. The whole mind-body connection continues to fascinate me. Yet, even though I'm a huge proponent of that and paying attention to what your body is trying to tell you and your emotions, etc., there's so much I don't know about it. So I am so excited that Dr. Kim is joining us today for a really interesting discussion on the mind-body connection. Why don't we just start with one of the reasons that I contacted you several days ago was because I don't know about all of you guys listening out there, but you know, this pandemic that we're going through right now is, let's face it, it's stressful, it's unprecedented. We've never experienced this before, so everything that we're doing regarding the lockdowns and the quarantines and not knowing what's next, the uncertainty, it's all brand new for all of us. But I was feeling, you know, I'm pretty chill about all this. You know, yeah, it's not fun. Yeah, it's scary. But I was realizing, you know, deep breath, I'm okay. I'm taking this one step at a time. I'm not going to think about the future because that does get stressful. And I thought, you know, I'm not actually that stressed out because I'm healthy. My kids are home. They're healthy. Let's just try to stay calm. But what happened is I noticed I was getting a headache every single day. I had a headache, no joke, every day for 6 weeks. Thank goodness it's gone now. Then I started getting hives all over my body. I was itching all over my body to such a degree I was getting disgusting, bloody scratch marks all over my body. And I thought, what the heck is going on? So I called Kim and I said, you know what? Instead of having this conversation, why don't you tell all my friends about this? Because I think deep underneath, even if we don't feel all that stressed and we think we have it under control, something must be going on. So why don't you start by telling us a little bit about that?
Yeah, there's a lot of ways that we think that we consciously register what's going on in our body when most of what's going on in our body is completely unconscious. Even the way that our physical body responds to stress, or our physical body is manifesting disease or symptoms that are stress related or emotional related, and we're not aware of those emotions. So we think, no, this can't be that because I'm not really that upset or I'm not worried. And I see this a lot with, you know, like with kids where they kind of somatize their anxiety. A lot of kids have so much anxiety going on.
Wait,
they're not always expressing.
I'm sorry for my naivete or ignorance. What's that word? Somatize?
They physicalize.
Okay.
And the soma is the body. Okay. So somatic is like a physical manifestation of those emotional energies. So they'll like physicalize the anxiety where they'll have a stomach ache or bowel problems or even irritable bowel syndrome that can, they can even develop inflammatory bowel syndrome where we see lots of cellular changes or food intolerances, or other things like headaches, chest pain, even problems breathing because of the anxiety. So sometimes it's not a conscious I'm anxious or I'm worried about this. It's totally unconscious, but it will physicalize and we'll become aware of those symptoms or that aspect of this energy that our body is trying to play out.
Interesting.
So it's so common, and most of us have learned to suppress our emotions anyway, just kind of along the course of our lives. Kids are usually really energy sensitive, but as they get older in the society we've been in the past, that's not really the language we speak. It's like, hey, put that away. Here's what's going on. And we'll try to be logical with our kids.
Yeah, stop being so emotional. You're being over dramatic, right?
Yeah, like to disconnect from their emotions. And it's like, no. Actually, that's a real wisdom of the way the body will speak to you, even before things need to physicalize and become a physical manifestation of disease. But for most adults, that's not where they're at. It's like things need to be in a scream before we really start listening. So it will really physicalize, and we'll have like rashes, headaches, visual changes, digestive problems, chest pain, bladder problems, infertility. Like there's so many things I've seen as a physician that are not organically a medical cause, but they're related to this suppression of energy in the body.
Interesting. And I don't know about anybody else watching or if you've had this happen to you before, Kim, but sometimes I catch myself, even when I don't logically, literally feel stressed at all, consciously, I catch myself like almost holding my breath or taking really, really short, shallow breaths. When I suddenly become aware of it, I realize, gosh, I'm tense and I'm not exhaling all the way, and I'm certainly not inhaling all the way, and I'm taking the shortest, shallowest breaths, which I know intellectually can't be good for us. So what do we do about the fact that all this is subconscious, or we're not really aware of all this stuff? How can we?
It's easy. The first thing to do is actually connect with your physical body. And you could close your eyes right now as we go through this and just begin to feel what is happening physically. You don't have to start to try to be aware of what's going on emotionally, because for a lot of people, you'll never get there. But do tune in. What am I feeling physically? So if you're like, start with the breath, it's like a great place to start. If you're tense, you're going to feel the breath is up here in the chest.
Right.
You're breathing and maybe using these muscles in the neck, in the shoulders, in the rib cage to breathe. Well, that is not the way your body is designed to breathe on a regular moment. You're designed to breathe through the diaphragm down here in the lower rib cage. It's at the top of the abdomen is this kind of a flat, it's a dome-like muscle, but it's a thin layer. So it'll go down as you inhale, it'll come up as you exhale, it relaxes. But if you just take a few breaths and relax your shoulders, you'll begin to activate that primary respiratory muscle, the diaphragm, and relax all of those accessory secondary respiratory muscles and shift your breathing. But that's not just about, oh, wow, all this neck tension I've been carrying and relaxing that, which is a big part of it. One of the biggest effects is this shifts your entire nervous system.
Interesting.
So if you just relax now, you could put your hands right on your belly to feel your belly relax.
Yep.
And as you breathe in, let your belly balloon out. By relaxing your shoulders, you could relax your neck, let your pelvis relax, and then over the next 5 inhale cycles, let your breath come all the way down to your belly. So it might take a few breaths, and it will certainly take a little focused relaxation in the shoulders to get there. But if you sort of start to practice, feel your butt on the seat, feel your shoulders relax, let everything go. And this is so important because it's been shown to turn off fight or flight, which is all those mind patterns, memories, automatic cycles that you're not even aware of,
right,
that are creating those stress responses in the body, old memory patterns, old belief systems, yet unconscious, and it will turn them off. And it will immediately turn on what's called the relaxation response, which has been shown to heal like every disease we've ever seen, every disease we've ever known is affected by this. So you're turning on the overdrive of the sympathetic nervous system, stress response, cortisol. People gain weight over the long term with this. People get anxiety when they're in that stress response all the time. Headaches, all kinds of physical illnesses.
Yeah, and that stress response, isn't that the same when our nervous system is in the stress response? Isn't that when we tend to, our body gives off a lot more cortisol, the stress hormone, which then
cortisol goes way up.
Yeah.
Yeah, so all those stress hormones, inflammatory chemicals, that's going to destroy your health. I mean, it destroys your metabolism, your ability to absorb nutrients and harmonize with food. Really out of balance. So you can develop thyroid disease, adrenal fatigue syndrome, chronic fatigue, all kinds of autoimmune disease are linked to this. So if you simply allow this shift and learn to ignite that, you turn on the parasympathetic nervous system, which is the harmony, health, it's health restored. It's all the basic housekeeping of your body. So you don't need to do so much to, I have a lot of patients, I'll say, well, I'm getting older, so I have to keep doing more and more to stay healthy. I have to work harder and harder all the time. And I'm like, is that really true? Could you let that idea go and let your body get on a different channel? Because your beliefs play a lot, into what is happening as well. And this is like the major way.
That's
just
a great point.
Feel what's happening in my physical body right now.
Yeah, that is such a great point, what you just said. And in case people skipped right over that or didn't quite catch that, our beliefs play such a big role in how we feel and so much else, right, Kim? I love
it plays a direct role what's happening in your cells, all the chemical messages, all of your hormonal messages, your neurologic messages, your brain firing. It has everything to do with what are your beliefs. That's actually been shown medically to be the most powerful factor and whether you are experiencing health or disease.
Yeah, that's such a great point. I love that you brought that up. And I also love that breathing reminder to do those breathing exercises and to breathe through a diaphragm. That I gave a very similar breathing exercise or I give that same exercise to a lot of my coaching clients. And it's something so simple that one can do even just while waiting in line at the grocery store, because we're kind of a little stressed out these days, just even going to the grocery store.
Yes. So this is a great time to do it. While you're driving your car, you're at a red light, you're like, I gotta get there. You're actually revving it up when you could be using that as an opportunity to do the opposite and cultivate health. Standing in line at the grocery store, because most of these things are, you want to get to the next thing. Right. I don't want to wait here. I got to do this. I got to do that. And what that does is it sends a chemical signal to your cells for inflammation and for stress hormones. And it limits not only the receptivity to healthy hormones, all the chemical states that allow the restoration of health, it also limits what's happening in your conscious awareness. So instead of seeing, oh, I could just do this, or hey, why don't I call so-and-so, or things that could be really magical synchronicities and open up your life to the prosperity, abundance, health that you want to create, you don't have that. You're not on that channel. You're staying on the channel of, I got to do more. I'm not okay. This is not okay. And you're rejecting the present moment. So it's like a dynamic increase in dis-ease because you're actually creating and cultivating those chemical states.
Yes, which just increases the anxiety and underlying tension. I love how I know that a while back when you were an emergency room physician, before you started the American Institute of Mind-Body Connection Health, excuse me, you said that you could see and literally feel the patient's mental and emotional responses, if you just how that basically kept them in their problems, in their disease. I didn't say that very well. Could you just elaborate on that?
Yes, I have always been really intuitive and energy sensitive. So it was super easy for me to perceive what's going on. Is this a physical, organic, medical issue? Is this emotional? Is this mental that keeps this person in chronic abdominal pain coming back and forth to the ER all the time, or severe headaches or autoimmune disease? And I'd be able to see all the different layers of what was really blocking their health. But even more interestingly, they're on a monitor. So some of the mind-body tools I would do with my patients in the ER, I would immediately see the manifestation of change in their body, in their heart rate, in their oxygen level, in their respiratory rate, in their blood pressure changes.
Wow.
And they would tell me, you know, oh my gosh, I'm feeling better, or they tear and have a big release of energy and their symptoms would completely release. But it was pretty cool to see physiologically what was going on, especially like their body's ability to take up oxygen would improve. So, you know, a patient coming in with chest pain, breathing fast and not oxygenating well. And you're like, okay, what's going on? The heart's racing. Are they having a heart attack? Are they having a blood clot to the lung, a pulmonary embolism? Like there's a bunch of things that could go on. So we'd get the lab sent off and do the mandatory things and look at that. But then I'd sit with that person and feel in like, what's really going on here with this chest pain, with these symptoms, with the changes in their body?
Or is there
and
more than what meets the eye, right?
Yeah, and I would say almost 100% was a yes. of the chronic, like this isn't getting better no matter what I do, where it would relapse and they'd come to the ER with a worsening of their symptoms. So, you know, I would simply assist them in releasing that emotion or meeting that emotional space that they've been unconscious of because they've suppressed it. And that's what would really let the energy move.
That's fascinating. So aside from, or in addition to that breathing exercise that you just mentioned, is there anything that you can think of that would help us right now during the pandemic? And I know in the future when the pandemic's gone and we have a vaccine and we're not worried about COVID anymore, there's always going to be something either in our personal lives or in our local community or in the world that tends to stress us out. So I know we talked a lot about breathing, and I think for me that is the number one. I just have to remember to do it. Is there anything else? I don't know if you talk about creative visualization, or what do you have your clients really focus on?
I would say that the best go-to would be EFT, emotional freedom technique, or tapping.
Please.
This is so powerful because this immediately gives your body new neurologic feedback, new information, even if you're totally unconscious of what's recreating those patterns. So like for you with the symptoms you were experiencing, you're like, hey, I'm okay, we got this. But your body was registering fear, danger, not okay, major change, unknown. And it already had programs for that is a stress state. I've got to respond. This is a threat. It doesn't distinguish between real versus perceived threat, which is the whole issue, right? You're not actually being chased by a tiger. Right. You're lying right there in your bed and everything's, right, okay. But it registers as a threat anyway, and all the bells and whistles go off and you can have lots of symptoms. Yeah. So one way to repattern that and become conscious, so lots of things change, is through this tapping technique. And we'll do a little bit here. I have a whole little mini course on my site at drkimd.com, and I have lots of free videos on YouTube that walk you through some of this further. But just in basic, there are points on the body, and you can just gently tap on these points to give your... Yeah, you can do 2 fingers. You could do one side. You could do both sides. It doesn't matter. Okay. But you just breathe in and out and begin to sense what's happening in your body. Start with the physical. Do not try to get too much awareness emotionally because it may not be there right away. So you just gently feel what I feel. Like, oh my gosh, I have this headache. Or, wow, what's going on in my digestion? I don't have any appetite, or the opposite, right? I want to eat everything. What
if you're just feeling general anxiety? Can you just say, okay, I feel
general anxiety. We'll do a cycle for that, and I'm going to have you repeat after me. So the next point is right under the eye, one or both sides, doesn't matter. Just gently tapping, breathing in through the nose, and do that relaxed belly breath. That will help a ton. And then just breathing out. You can breathe out through the nose or through the mouth, because your body actually is releasing energy, even if you don't feel it yet. And then under the nose, right at the midline. So just gently tapping there, breathing in, relax your shoulders.
Are these acupuncture points? What are these?
They're acupressure meridians.
Okay,
So they're energy
meridian.
channels through the body that give direct feedback to the amygdala, which is where your stress is registered. And it's like that's where you set off all the alarms. So old programs, belief systems, memories, triggers. So now underneath the collarbone in that little soft area, and you could use a few fingers there. Inhaling, relax your shoulders. And you'll automatically feel that belly breathing when you relax your shoulders. And then exhaling through the mouth. And after you've done this, so underneath the arm is the next one, right at the nipple line. After you've done a few rounds of tapping, before just practicing, you could just use one point and it can bring you into peace. So we'll talk about that because you might just be like in a meeting and you're like, okay, Kim, we're good. I gotcha. You're okay. You feel your heart racing. And then top of the head.
If you're on a Zoom meeting, you can do it under your arm and no one might notice.
Yes, you can do it any way you want. Or even just like, right here, just rubbing this area. There's lots of subtle ways just to take care of yourself. But if you've done the whole sequence before, it sort of connects these points. So you get even feedback throughout, even if you're just tapping on one point. So we're going to tap on the karate chop point, and this is where you do your setup. So that's kind of your start of the whole thing. And I'll have you do the practice and repeat after me, and everyone who's watching, repeat this out loud if you can. Even just in your head is helpful as well.
Someone's saying, Annie is saying it brings you into peace, and she loves that. I love that too, Annie. That's a really good phrase.
It's powerful.
Yeah.
So, and we have lots of brain studies that show a reequilibration and harmonic patterns in the brain. We have lots of immunologic studies that show, I think it's like 125% increase in your IgA, which is one of the major factors to fight against colds and flu, like coronavirus. So it really allows your immune system to strengthen. All right, so we'll start this round for general. So you'll say, even though I am so worried.
I don't know if the others. You froze. Okay, you were just about to start. So say that again.
Okay. So even though I am so worried about everything going on right now. And you repeat.
Even though I am so worried about everything going on right now.
I choose to embrace. Yep. I choose to embrace peace now.
I choose to embrace peace now.
Good. 2 more times. So the 3 setup phrase, just to integrate that. Even though I'm so worried and anxious, I feel out of control.
Even though I'm so worried and anxious and I feel out of control.
I choose to embrace this moment now.
I choose to embrace this moment now.
Even though I don't like what I'm feeling in my body.
Even though I don't like what I'm feeling in my body.
Or what's happening in my life.
Or what's happening in my life.
I choose to love and accept myself fully.
I choose to love and accept myself fully.
Good. So just relax. Inner eye. It's okay to embrace what I'm feeling in my body.
Tap it away, Kim.
So you can say it out loud, or you can acknowledge all this stress and fear.
All this stress and fear.
Outer eye, what I'm beginning to feel in my body.
What I'm beginning to feel in my body.
Under the eye, that I don't understand.
That I don't understand.
Under the nose, that I can't control.
That I can't control.
On the chin, I've learned to try to control things.
I've learned to try to control things.
Under the collarbone, but that is not serving me.
But that is not serving me.
Under the arm, what if I just embrace what I'm feeling now?
What if I just embrace what I'm feeling now?
Top of the head, these physical symptoms.
These physical symptoms.
Inner eye, this unease.
This unease.
Outer eye, anxiety and stress.
Anxiety and stress.
Under the eye, worried about myself, worried about my kids.
Worried about myself, worried about my kids.
Under the nose, worried about future.
Worried about the future.
On the chin, acknowledging what's going on in me now.
I'm acknowledging what's going on in me now.
Under the collarbone, and letting it neutralize to just be what it is.
And letting it neutralize to just be is.
Under the arm. I can feel and witness what's happening in my body now.
I can feel and witness what's happening in my body now.
Top of the head. It's safe to feel what's actually happening in my body.
It's safe to feel what's actually happening in my body.
Good. Inner eye, and just witness it and breathe.
And just witness it and breathe.
Outer eye. All these things I've been afraid to acknowledge.
All these things I've been afraid to acknowledge.
Under the eye, that I do feel out of control.
That I do feel out of control.
Under the nose, that I do have some fear.
That I do have some fear.
On the chin, maybe fluttering in my stomach.
Maybe fluttering in my stomach.
Under the collarbone, maybe pressure on my chest.
Maybe pressure in my chest.
Under the arm. And all these worries about everything and everyone.
And all these worries about everything and everyone.
Yeah, especially as women, that may be part of the equation. On top of the head, I choose to come into harmony in my body now.
I choose to come into harmony with my body now.
By just acknowledging all of this.
By just acknowledging all of this.
Good. Breathe in through the nose. Relax your shoulders best you can. And then exhale through the mouth.
Oh, I do feel better. I really do.
You'll feel lighter. There's three things that can happen. First of all, a lot of people will yawn or tear, and that's energy moving. That is perfect. That is awesome. You do not need a reason to feel emotional or to let emotions move through. Just let it happen.
So if you start to tear up, it doesn't necessarily mean you're sad, and if you are, that's okay anyway, because it's a release.
It's okay. Your body, part of you is crying and releasing energy. Don't require it to have a reason. Like if you think of your kid and you're like, why are you crying? Versus you're like, sweetheart, what do you need? I'm here. I love you. Let it all out. I don't need her to explain it to me. It's healthier for her to let it release. She doesn't need to go through the whole, here's what's, because I'm not going to be afraid. Oh, wait, I need a reason. I need to know. So many people are afraid of their emotions. And so they can't just let the energy move.
Okay.
They're like, I don't even know why I'm crying. I'm so sorry. I'm so sorry. Screw that.
Yeah.
Let the energy move. You deserve to be free. And if your body wants to express, let her express.
Okay.
So you may feel a lot of energy move. You may feel lighter or feel like, whoa, all those symptoms went away.
So is that why, sorry to interrupt you. So is that why after a cry, we always feel so much better? We feel lighter. Is that energy release, isn't it? I never
You have moved a lot of deep energy. Yeah, you've moved a lot of energy. And it's a great thing. Like my husband is really able, we've been together for I think 10 years now, and he gets it.
And he's
that
a doctor
like sometimes
too, just
energy.
to let everyone else know. Go ahead.
Yeah, he's a doctor in radiology, but he gets like sometimes, because he used to really feel like, I've got to control what's happening and make her feel better. But sometimes I'll just like move a ton of energy and let loose and just cry. And he's like, just come here, baby. What do you need? Here you go. Let it all out. And then I'm like, oh, that was good. And we don't even need to talk about it. Like the energy moved. Maybe we'll talk about it. Maybe I'm just like, whoa, there's a lot moving through and I feel better. And he can just hold the space for that without requiring me to, I don't know, like handle it or explain it or requiring himself to handle it and make it go away.
Right.
He trusts like this energy is going to move. Yeah, and we do that to ourselves because we don't understand. Our body is a self-healing organism. Our body will move energy either through the skin, right? Because that's the most superficial organ, and you'll like rash it out or whatever.
So that's why head to toe hives, you think? I mean, they only went away through Western medicine, which is just like covering it up. I hate to say that, my doctor gave me something for that and made it go away because I couldn't get to sleep because I was scratching everywhere and bleeding everywhere.
Yeah, if things are so severe... If things are so severe that you're like bleeding through your skin and you really don't know what to do, like there's nothing wrong with suppressing that. But the point is, when you suppress it, the energy goes deeper into the body and has to try to work itself out on the mental or emotional levels that it wasn't working out on the physical level. But it's okay because right now you have some tools to let more of this unrealized energy, subconscious stuff come through, and like, oh, I can assist myself through this. And sure, there may be medications you want to use. It's okay, but realize that your body's trying to move energy, and what can I do to support that rather than make it wrong and have to suppress it.
Right. And go get it from the source and from its origins. And
yeah,
a lot of that stuff.
Get what you need.
Yeah.
So you may feel lighter, you may feel nothing, in which case just tune in more physically. What am I feeling? And tap on that. Or for a lot of people, it will come up. So you may feel worse. You're like, whoa, I didn't realize how much fear there really was. It's so intense, and I'm feeling the pressure, and I'm feeling the fluttering, and don't let that scare you. That's actually a sign that the suppressed energy is rising so that it can move out. So do a little more tapping, like it's okay to feel what I feel.
Right.
I hold the space for myself to embrace this. Now, you're not tapping to make it go away.
Okay.
This is important.
Okay.
Yes, it will 100%. I've seen resolution, physical illness begin to dissolve. But do not try to tap to make it go away. Instead, tap to nurture yourself through it. Tap to love and embrace yourself. This is really, really important, because loving and embracing yourself is what lets the energy move.
Okay.
Making it go away can actually be suppressive, where you're like, I don't want to feel this. It's not okay. I must have done it wrong. I have to tap some more.
Yeah. So you're almost drawing it to you, and you want us to remember just to self-nurture in this moment, and that's what we're trying to do.
Yes.
Okay.
Yes. And as you do that, just like with a child, what do you have, sweetheart? Whatever you have, I'll hold the space for you. We can cry all day. I'm here. That's actually what's going to let the child feel safe and like, no, we got to figure this out. What's going on? Come on, stop crying. I got to make you feel better. The kid's like, and they'll just suck it up, and they may look better, but they didn't actually resolve anything.
Right.
And that's why so many kids are experiencing severe chronic anxiety.
Interesting. And they don't have the tools to articulate what they're feeling anyway. Even my teenagers don't, I've noticed. Even I don't sometimes. So where can we find out more about you, Dr. Kim DEramo? I know where I find your website, but you told me an easier way to remember your website.
Yep, it's drkimd.com.
So we don't have to spell out
your
name.
And I'm also in the Mind Body community in Facebook. That's my group. If people want to join the Mind Body community, it's a free group.
Awesome.
I go live for a broadcast every Wednesday at 11 a.m. Mountain in the Mind Body community. So people can join there.
I didn't even know that.
And I'm pretty active in YouTube. So yeah, we've done a lot lately around what's coming up with coronavirus and just getting clarity on like, what do I really need to do?
That is so great.
Yeah.
And do you have anything on your website? I was there this morning, but I'm not looking at it right now.
There's a really great
on the tapping
quiz.
Because what if people want to do that again?
Well, there's a quiz. If people hit the Start Here button on the front page, it brings them through a little of a quiz to get some clarity on like what's going on. Is it primarily physical, emotional, mental? And then there are recommendations there. But there's an EFT mini course. It's really easy to get. It's drkimd.com/EFT. And it'll give you some really great videos and understanding tap course for anxiety, depression, pain, fatigue.
Wow.
There's like a little session for each one of those that are really powerful. And I've had people tell me my pain is gone after doing this tapping session.
Yeah, tapping
or I no longer have that anxiety.
Powerful. Yeah.
It's pretty incredible. It actually repatterns your brain, your nervous system, so that the signals in the communication system of your body are completely resolved. So the old memories, traumas, belief systems, experiences you've had in the past can neutralize so they're no longer causing harm.
How often should we be doing it?
You can do it every day when you wake up, or you know what else is great? There's a sleep meditation. Before you go to sleep is a great way, because you're like, all right, I'm going to turn it all off and go to sleep. It repatterns your brain, so a lot of healing can happen during sleep. So drkimd.com/sleep has a free EFT sleep meditation you can use before bed.
I love that.
But anytime, like during the day,
with sleeping right now.
Oh my gosh, that if you do one thing, That's a really powerful thing. I've actually had people resolve hot flashes.
Ooh, I could use that.
Of course, insomnia. Really weird things that you're like, huh, because it's communicating to the body. So drkimd.com/sleep.
Okay, I'm
But you
going
can
there for
use
sure.
EFT anytime you're like during the day and you notice something coming up.
Okay.
Instead of like, I got to just suppress it and march on, pause,
Right.
get a little curious. What's going on here? Let me nurture my body. Body, you're okay. Just say, hi, body. How are you?
Right.
You can scale 1 to 10. We didn't do that in the beginning of our EFT, but 1 to 10, how severe.
Okay.
So you notice, like, does it go
change.
down?
Okay, yeah.
Does it go up? Did it stay the same? You'll usually see it go down or go up, which means something deeper is coming up.
Okay.
And you do another little round of tapping, but you'll see the effect on your body. So when you are experiencing something during your day, it's a good time to do it. But having practiced it as your like evening ritual before bed or your morning ritual when you get up, just 1 or 2 rounds, that really helps. So when you're in the trigger,
Right.
you got this.
That's what's key. I mean, I've known about tapping for like 10 years now, and I've tried it here and there, but I've never really done it as a practice every day or every morning or every evening or something like that. And like everything in life, like even just brushing your teeth, if you just do something once, you're really not going to get the full benefit of regular practicing. And I love what you just taught me there, because even though I've known about tapping, I didn't really, I don't know, like actively, intentionally connect the idea with just allowing ourselves to feel, and also with the idea that that goes so against what we, especially in the Western world, with good education especially, have been taught our entire lives, which is be motivated, go do it, no pain, no gain. If you're going to make it happen, you got to make it happen. And I believe in taking responsibility for one's own life, but we're all taught that it's all like boom, 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 boom. And sometimes
you can't take responsibility for your life if you're suppressing. You can't. And as a physician, this is the thing I have seen create the most healing. Period. The freaking end. Like unthinkable things, severe chronic pain on opioids, people like chasing it, acupuncture, physical therapy, trying to do everything they can, have a complete resolution of their pain from a 10 to a 0.
Wow.
Using tapping. When I see people like virtually all over the world and can guide them very, very specifically so we can get to that. But even just on your own, in the bathroom mirror after you brush your teeth, even if you just say, hey, buddy, I'm here. I love you. What's going on? What's happening? Okay. It's okay for us to be whole. And then you go through your day, not like from here up. I got it together. I'm good. Everything's good. Let me stay in control. Let me be positive. You let that shit go. You embody your whole body, all of it. The right, the wrong, the good and the bad, the dark and the light, like all of it. That is where you have unbelievable power. And you really show up and you make things happen. Not because you're making it happen. You're allowing so much to happen in your life because you've accessed your power.
So someone in the audience is asking, can you do tapping if you currently have a concussion or if you got one a few days ago?
Great question.
Would that be good or bad?
I've had several clients with concussion and brain fog and all kinds of sequelae from that have a complete resolution using tapping. So yes. So
it's okay.
100%.
Good to know. Okay.
Yeah, and after concussion, there's a lot of reorganization happening in the brain, and so you're assisting that. And it doesn't have to be a bad thing that this change happened. For all the people I've seen, it ended up being a huge gift. Like they left the corporate job and discovered and uncovered gifts and talents and moved forward in a whole different arena of life. So what they thought was like this bad thing they had to fight against and hold it together ended up, when they received it, creating a really beautiful change.
Wow, that's powerful. Well, Dr. Kim, thank you so much for helping us with this today. I got to have you on more often, babe. You're awesome. So Kim used to live near me in the Boston area, and now she has moved several years ago. She moved out to Colorado, so we don't connect as much as we used to. But I am so grateful for this today. Thank you so much for being here. Everyone, please go take a look at all those things that she mentioned, the tools that she's got, and the quiz, etc. And the tools on sleeping? 'Cause I
I'll
know a
put
lot
the
of
link
people.
here because people are asking what's the best way to get started with tapping.
Oh, right, yeah.
And there are free resources on the page. So if you go to that page, it will explain some stuff,
Will you put
explain
the
some of the
link in the
science behind
comments
it.
when this video
Yep.
live is video
I've got
finished?
it right here.
Okay.
Yep.
Perfect. Awesome.
There you go.
Well, Kim, thank you so much for joining
Right.
us. And if anyone has any questions, both now, either now or later, if you're watching on the replay, please don't hesitate to ask those questions in the comments, and either Dr. Kim or I, if I can, will be sure to answer you right there. Okay? Thank you
All
so
right.
much
Lots
once
of love,
again.
everybody.
You too. You too.
See you
Bye,
soon.
everyone.
Bye.
Bye.